Okay, hi everyone, and welcome to another media briefing. As always, we'll start with a presentation from Dr. Hirji, then move into a time of questioning with one question, one follow-up for everyone, and then time for a second question if there's still some time left in the meeting. So I will turn over to you, Dr. Hirji.
Okay, thanks, Brittany. Hopefully everybody can see the slides up now.
It said that you started screen sharing, but nothing's coming up.
Okay, sorry, my computer seems to have frozen for a moment. Am I back now?
Yeah.
Let's try that again. Hopefully it doesn't freeze this time. Of course, it does that as soon as I start. Okay, doesn't look like it's frozen now. Why is it saying my screen sharing is paused? I assume you're not able to see the screen right now.
No, it says that you're screen sharing, but it's still black.
Okay, that is on. Let me try that again. There was a resume screen share button, but it didn't seem to work. Okay, seems to have paused again. Let me try and kill a few things on my computer in case that is what's giving us trouble here. Sorry about this, everybody. Of course, technology wants to fail just when we're starting.
No problem.
That's weird. Every time I try to share, it says sharing is paused, and I'm not sure what I do to stop that. I'm going to try and maybe disconnect and then reconnect to see if that helps. Okay, that looks better. So apologies for everybody for that. Technology has not been my friend this morning, I guess. Anyway, let's get started. So I think, the good news everybody is probably aware of is that we are seeing a good trend with our hospitalization numbers having finally peaked and starting to come on down. And so this is what we're seeing in terms of the provincial numbers of hospitalizations. And really over the last week, it looks like we've peaked and started to see a bit of a downwards trend. With the ICU numbers, it's a bit more flat, but maybe there's just the early signs that things might be starting to improve there as well. When we look at the Niagara data, I think it's a fairly similar pattern here where it looks like we have peaked and have started to see it coming down. ICU numbers likewise seem to be kind of flat. And then, I think it's a fallacy to focus just on the people who are treated for COVID-19, because I think even those who are not being treated for COVID-19 can have their illness worsened by COVID-19. But nonetheless, even if we focus on that number, we can see at least there's been a positive trend there as well. And so that I think is definitely a good sign. Probably hospitalizations are starting to improve because infections in the community are coming down, or at least they're coming down in the people who are at greatest risk of being hospitalized. Those would be the elderly, those would be vulnerable people. And hopefully it's a sign that they got their booster doses. If we're looking at our cases over time, this is around when the province did their change in testing. So these numbers aren't really representative of the overall population, but we can see it has been coming down. So at least the group who is getting tested, so that's people in long-term care, healthcare workers, and people hospitalized, at least it is seeming like infections are coming down in that group. I'm cautious about interpreting that more widely to reflect everybody else, but perhaps it is more likely reflective of everybody else, since we are also seeing that hospitalization number go down. In Niagara, very similar trend here, where we have started to see those number of cases on their way down. And then when it comes to outbreaks, this is another metric that I wanted us to focus on. And if there's more infections out in the community, we'd expect there to be more outbreaks. And we have seen that there's been a little bit of cresting of our outbreaks, and we're starting to see those outbreak numbers come down a little bit as well. So that's certainly good news. I talked last time a little bit about our wastewater data, and it's not, I think, the most reliable signal of what's happening. We took another look at what our wastewater is doing here. And so this is the Grimsby wastewater treatment plant, where it didn't really make much sense with what the pattern was showing, where through late December, it wasn't really showing a whole lot of COVID-19 activity. We're seeing, kind of a consistently high COVID-19 activity through January, but no real sign here necessarily that things are coming down. When we go to the Port Weller wastewater treatment plant in St. Catharines, again, we can see here much more what we'd expect, where there's a buildup of infections over the course of December, and we're at quite a high level in January. Maybe there is some sense it has come down a little bit, but of course, this is a little bit, I think, you get these weird spikes. So it could be that maybe, if this data point wasn't quite as low, maybe you're not necessarily seeing that, but maybe there is some sense there that infections are coming down. And then over in Niagara Falls, I think it's less clear here with the wastewater treatment plant, where it looks like it's staying pretty consistently high. There's a one data point that's a bit lower, but I'm not as convinced that this data is showing it coming down. But I don't think any of these wastewater data are showing a signal of going up. And so we're probably at least at a plateau of infections, and hopefully are indeed coming down with infections based on some of the other data we've seen. All of that being said, that as good news as it is, that hospitalizations are coming down, there's perhaps fewer infections out in the community. When we look at average daily deaths from COVID-19 in Ontario, we have not yet peaked in terms of people dying from this infection. And this wave is, clearly just as bad as the second wave or the first wave was in terms of persons having died. And we're not yet at a peak. And so I think that's really notable. And even if we are at a peak and we start to come down, that means that, half the deaths are on one side of the peak, half the deaths are on the other side of the peak. So there's still, I think, a lot of human suffering that may still come with this wave here. So I do think we need to be mindful of that going forward. The reason I think we perhaps have seen some improvement in terms of the hospital numbers is really when it comes to this mobility here. This is a reflection of how people have been out and about and perhaps interacting with each other. And we definitely saw a drop off in that in mid-December and early January as the province brought in measures to start to reduce that. We have unfortunately seen a little bit of a pickup of late, which I think does give me some concern that perhaps this decline might not be as sustained as we would like. And the fact that the province is reopening somewhat today, I think further makes that going to be more difficult. And I do think there is, some reason to be worried that things may not stay in the trend that we have seen of late, given this increase in mobility as well as what the province is doing today. If we take a look at the Niagara mobility data, it's somewhat similar where, in late December, early January, we got to a reduced mobility, which wasn't too dissimilar to what the third lockdown showed us. Or actually, this is the second lockdown here. But we've seen an erosion of that, and people are now out in the, going out from home more often as we've got into the middle part of January. And in terms of people doing shopping and recreation, we have likewise seen that while we reduced that for a bit, it did start to creep up a little bit already. And of course, that's no doubt going to start to go up now that things have started to reopen. And so this is all, I think, a potential threat that we could see infections start to climb once again in the community. And with that, we could see increases in hospitalizations. And so I do think we need to be quite mindful of that. The one thing that may prevent that from happening, and what I think everybody is hoping is going to happen, is that vaccination prevents infections from rising again, thanks to the fact that over the last little while, we've got a lot of vaccines and particularly booster doses delivered. And so this is what first doses look like here. The blue lines here are second doses, and then the green lines are third doses. And I think it's significant that if we look at the adult population who's eligible for boosters, more than half of adults have gotten their booster dose. And so, people with first, second, or no doses only are now outnumbered by people who have actually got their booster doses. And if we do manage to get through this reopening and not see a big resurgence in hospitalizations, I think it's going to be thanks to this that we've got lots of people with their booster dose, and particularly older people who are more at risk of being hospitalized are the ones who've disproportionately gotten their booster dose. And so I think that is very good news. We don't want to stop here, though. We want to at least get these numbers even higher. And I think we have this big group here who's lower risk of being hospitalized, but still could be hospitalized. And we want to make sure we get them to get booster doses as well. I'm also quite focused on schools being open and making sure that we keep them safe, and vaccination is going to be really important for them. A good piece of news here is in that 12 to 17 age group, in the 2 weeks since we did our last media briefing, we've gone up from about 77% to 80%. So we have definitely seen some real movement amongst this teenage group. Not as much movement in terms of the 5 to 11 age group, where we seem to be stuck in the mid 40s. It is definitely going up, but only by a little. We are starting to get the second doses out, and we're starting to see that second dose number. And I imagine over the next couple of weeks, we'll see the second dose number catch up and be quite close to the first dose number. But we're obviously hoping more people will sign up and get their first doses so that these children can be even more safe when they're in school. And we are, of course, doing lots of additional promotion. You may have seen some ads we've bought, which is all about trying to hopefully encourage more people to come and get their first and second dose, especially in this childhood age group if they haven't. And of course, get everybody else to get their booster doses. I want to take a moment just to highlight how important these booster doses are in terms of the immunity that people are getting. Actually, before I do that, I just want to quickly note that what we're seeing in terms of vaccine administration in our society, where we, of course, ramped up our delivery of vaccinations quite high, but you can see we've really tailed off back down to where we were maybe in late November at this point. And so I think there's lots and lots of room for people to come to clinics or come to pharmacies or primary care to get vaccinated. We're really operating at maybe 20% of Niagara's capacity to deliver vaccinations. And there's lots more opportunity for people to get those doses, both those booster doses or even the first and second doses, they don't have it. And we really want to emphasize that message because that's really, I think, what's going to make sure that we don't see a resurgence of this Omicron wave is if people get their vaccines and particularly get those booster doses that keeps them safe. And on that topic, just to show you the impact of the booster doses. So this is a provincial data on what we're seeing with infections. And you can see, this is back in, September, October, November, when we're dealing with the Delta variant, and vaccines are giving very high protection against the Delta variant. When the Omicron variant came on the scene, we saw, immunity really plummet. And then with booster doses, we can see our immunity to infection has come on the way back up. And with only 53% of adults vaccinated so far, you can see we probably have even more room to grow to get our immunity even higher up. And so this is really good news, and this shows clearly that the booster doses are having a real impact in giving people protection from infection. The good news was that the vaccine, even despite the loss of protection from infection with the Omicron variant, there still was very good protection from being hospitalized and very good protection against ending up in an ICU. But with those booster doses, we have started to see these actually come up a little bit as well, which is certainly good news as well. And so I think this really highlights that those booster doses really matter. They're preventing infections, and if you're not getting infected, you're not going to be hospitalized or be in an ICU or have a bad outcome. And even those who do unfortunately end up in an ICU in a hospital, that vaccine is giving really good protection, even with 2 doses, and then even better once we get 3 doses in. It's a really good reason, I think, for people to get that booster dose. We have some data here in Ontario now that's showing how effective those booster doses have been. And so this is how effective the vaccine is against the Omicron variant specifically. And you can see, within the first couple months, people had about 40% protection with 2 doses against the Omicron variant. And over time, that declines. And after about 6 months, protection against the Omicron variant is very low. And I think that reflects what we saw in the previous slide. You can see that once people get a booster dose, within those first 6 days, their immunity jumps back up to where it was with 2 doses. And then after a week, it's even higher, and now higher than it's been before. And so this is clearly showing that that booster dose is definitely enhancing people's protection against the Omicron variant. And definitely, I think, something that we want to make sure we have for protection. If we look at this data here against symptomatic infection, again, this is Ontario data. Again, the similar trend. We start off with maybe 40% protection. It kind of levels off over 6 months. And then with the booster dose, we jump back up, get ultimately up to about 60% protection. A small thing I just want to highlight here is that this breaks down. This is the Pfizer vaccine, and this here is the Moderna vaccine. And what is the difference in impact in them? And you can see that if you starting here, that within those first 6 days, the Pfizer vaccine gets immunity up to here, but the Moderna vaccine gets it up to here. So there's maybe a good 5–7% benefit from the Moderna vaccine over the Pfizer vaccine in those initial days. And then even at the final point, it looks like the Moderna vaccine ends up with higher immunity than the Pfizer vaccine with the Moderna versus the Pfizer booster. And so there's some evidence here that that Moderna booster is giving people better protection against the Omicron variant if they get that as a booster compared to the Pfizer vaccine. If we take a look here at severe outcomes, you can see, similar trend here, as I showed previously, where hospitalization was always pretty well protected, even with 2 doses. But we can see it goes up a little bit with the booster dose. And you can see both Pfizer and Moderna get you to a very high level of protection, so not as much of a difference there. Last time I showed you some similar numbers from the UK, and the UK actually has come out with some new data here, and I thought it would be worth just quickly looking at it here. And so these gray dots here is the protection from the Omicron variant, and this is with 2 doses of Pfizer vaccine. And you can see protection started around 60% and sadly declined over the course of 6 months until people had only a little bit of protection against the Omicron variant. When they get their Pfizer booster, you can see the immunity jumps right back up. Though unfortunately, over the course of 15 weeks, it starts to decline again. However, people, if they got a Moderna booster after those 2 doses of Pfizer, you can see their immunity came up to here, which is a bit higher than that Pfizer booster gave. And then the decline in immunity isn't as much as it was for the Pfizer booster. And so you actually have ended up with a little bit stronger and longer lasting immunity with that Moderna booster to the Pfizer booster again. And this is, again, just to get symptomatic illness. This is, 2 people who got 2 doses of Moderna and then got a Pfizer Moderna booster. And you can see, again, it's not as, pronounced, but again, it's probably a little bit higher protection to get a Moderna booster. And then that Moderna booster seems to maintain that protection a little longer than the Pfizer booster does. And if we're looking at people, based on that, In our clinics in public health, we continue to really recommend that people get Moderna as the booster dose of choice, because that seems to give stronger and longer lasting protection. And especially against the Omicron variant, I think we want all the protection that we can get. People under 30, where there's a greater risk of myocarditis, and given Moderna does cause myocarditis a little bit more, we're recommending Pfizer. This is a group at high risk of myocarditis, so we don't want to give that side effect. And they're also lower risk of being hospitalized or having a severe outcome from COVID-19. And so I think given that they're lower risk, we can probably trade off to give them slightly less protection so that they're prevented from those side effects. But I think for most people, Moderna is really the vaccine of choice to be getting for booster doses. And I think we'll continue to recommend that at our clinics as the best protection that people can get for the vaccine. I want to stop here and just talk a little bit about where we are hopefully headed after this Omicron wave, especially if we're lucky and we don't see any resurgence of the Omicron wave with our reopening. And I think the big question everybody's asking is about is COVID going to become endemic? Can we switch over to being endemic? And does that mean things are over in the pandemic? And I just want to talk a little bit about what exactly endemic means and what that's probably going to look like and how we need to hopefully adapt to deal with that. So, this is just hypothetically what the virus is going to do. There's exponential growth. It's going to start growing and it's going to speed up and start to spread more over time. And this is what we've been living over the last couple of years effectively, especially during surges, where we have basically epidemic growth or pandemic growth of the infection. And that's really because the virus's infectivity is stronger than the immunity in the population. And so because the immunity isn't strong enough, because the infectivity is greater, there's going to be more and more infections spreading over time. And that's just unfortunately the way it's going to go. Obviously, what we have done in society is that we have tried to compensate for our low immunity by also having social restrictions, wearing masks, doing contact tracing to bring some additional downward pressure on that virus's ability to spread. And as a result, for much of the last 2 years, we've been able to flatten out the spread and keep COVID-19 under control, even though we did not have widespread population immunity yet. And these have been basically what has helped us limit the spread of infection. What we've, of course, tried to do is that with vaccines, we have tried to add additional population immunity. So we increase the size of that bar. So now we can start to rely on that. Unfortunately, what we have seen is with the new variants emerging, we are now at a stage where this is not going to be enough to stop the virus on its own. Herd immunity would be the place where we get enough population immunity from vaccinations so that we can counterbalance the virus's ability to spread and we'd be able to continue to keep COVID-19 under control. With the Omicron variant, we are now at a point where it's pretty much theoretically impossible to get to herd immunity, at least with the current vaccines that we have. And so that's never going to be a situation that we'll be able to reach in where we can get to complete balance. Now, if we get population immunity from vaccines and some people also get the infection and that confers them some immunity, we'll probably eventually get to a stage where the virus's ability to spread is balanced out by the immunity in the population and things will sort of flatten out. And that will be basically the endemic state. But just because it's endemic doesn't mean that we're going to see things stop. To get that enough population immunity is assuming that we're going to get enough vaccine-derived immunity, but we don't know if it's going to be high enough from the vaccine, and I think what we're seeing is it probably will not be. We know that immunity seems to be waning over time, and I've shown you some graphs of that. So even if we do get to that endemic state, immunity is going to wane over time, and we're going to lose that equilibrium, and once again, the virus will be able to spread, and we'll probably see additional surges of the virus and more infections. And with those infections, more people will get some more immunity, and that maybe will bring things back into balance. But we can probably expect that there will be some additional waves as a result. Not all the world is already vaccinated. We're going to have world travel resume. People from unvaccinated parts of the world will travel here. And when they do that, there's going to be ability for infection to spread here because there'll be more people unvaccinated around. And so we'll not have that same population level immunity. And of course, as new people enter our society, as new children are born, they're not going to have immunity. And so that'll create another area where the virus can start to spread and from there spread to others and throw us out of balance. And so I do think there are some causes for concern that we are going to be dealing with challenges. And of course, as long as the virus is spreading throughout the world, we're going to get new variants. I think we have seen already that variants continue to arise. And I think it's almost a foregone conclusion there'll be new variants. And of course, when a new variant arises, we're again going to be in a place where maybe the vaccine doesn't work as well. And so I think we need to look forward to endemic being a state that is not going to be stable, where things basically go flat and everything goes back to normal. I think there's a lot of reasons why population immunity will erode over time, or new variants will emerge, and our endemic state will be lost, and we'll go back into temporary surges of infection. And, this is really what we see with other endemic diseases. Influenza is an endemic infection. But as we all know, every year we basically see this surge of influenza infections. And some years, yes, it's a smaller surge. Some years it's a bigger surge. The timing maybe shifts a little bit, but pretty much every winter we get a surge of influenza infections. And that's, a pattern of endemic disease. And that's because over the course of the year, people's immunity to influenza wanes. The influenza virus evolves a little bit. We don't have a vaccine that's always perfectly matched or perfectly effective against that infection. And so every winter we see a surge of infections because we no longer have enough immunity to keep that surge from happening. If we look at another disease like pertussis, this is pertussis here. And since the early 1980s, we've had a very good vaccine against pertussis. And you can see for a while we had infections low. But periodically, we see these spikes of infections where pertussis surges back a little bit. The most recent one is 2012-2013, where we saw a spike of pertussis infections. And that's, again, a reflection that the immunity from the vaccine wanes, and we start to see that infection resurge. And this is a study done in the United Kingdom by Keeling et al. Here, which was really trying to model out what would happen with COVID-19. And so these red dots basically represent the actual number of cases being seen. And this is, post third wave, and then the UK fully reopening in May, June, July, and seeing a resurgence of cases. And then they modeled out what would happen. And so this is a blue line of what would normally happen. You can see there's a surge, and it'll come back down as people all get immunity from that infection. But then eventually immunity will wane, there'll be another surge, etc. And then they modeled out, of course, if we got booster doses, what would happen. And you can see there's different patterns of infection that the booster doses do. And in general, they drive the infections lower than that blue line. But you can see there are still surges of infections that occur no matter what we do. And I think that is going to be the nature of endemic. We are going to still see surges of infections. And this is not going to be, just a switch is turned, we are endemic, and everything goes back to normal. And I think, this was a headline I saw this morning in the Globe and Mail, which I think really captured it well, that it's a delusion to think that if we let the Omicron variant spread and infect everybody, it's going to end the pandemic. I think it'll get us to an endemic state, but that endemic state is going to be punctuated with many surges coming back. And of course, if we do end up in an endemic state with surges come back, we're going to see more people getting sick, hospitalized, and having long COVID. And even if we somehow do get enough population immunity that we can continue to keep things under control, and we maintain that immunity over time, so we're not seeing those new variants, or we're not seeing waning immunity, we'll still have a high level of COVID-19 going around. People will be getting hospitalized. People will be suffering from long COVID over the long term. And sadly, some people will pass away. And so just to sustain even endemic state where we don't see those surges of infection means we're going to have more burden on our hospital system over the long term and basically perpetually. And we'll sadly see members of our society continue to be lost. And I think we need to be prepared for that. As if we're not going to do anything else once we go to endemic, we're going to need to invest a lot more money into our healthcare sector to really manage that. And we'll have to accept that we are choosing that we're going to let persons in our society die. Now, I think that is one option of how we deal with endemic, but I think there is another option for what we can do. Just to highlight that, if we do, go down this road, we are getting lots of people hospitalized, lots of people suffering from long COVID. If we look at what happens in our influenza season every year, our hospitals are already overwhelmed. And so it is not going to be something that we will be able to sustain unless we do a lot of investment into our hospitals. I wouldn't expect surges to be as bad once we get to that state, but they will still affect us. And especially if those surges are in winter when we have flu season, that's going to be a difficult time to manage. And so, the key message here is, to me, endemic is not necessarily going to be harmless. And I think we should try and find a different way through this. And I want to highlight a couple examples of how we've managed to deal with other infections. And so I'm just showing up here, these are the top causes of death in Canada back in 1910. And then fast forward 100 years, this is what we have. And I really want to highlight number 2 and number 3 on this list. You can see pneumonia and influenza has remained a major cause of death. It's fallen down to number 6. But tuberculosis, diarrheal diseases, they're not a major cause of death anymore. And actually, all of us know this. We don't really hear about people getting tuberculosis or diarrheal infections anymore. Tuberculosis in the 1800s was the cause of 25% of people passing away. And nowadays, nobody really dies from tuberculosis. At least we almost never hear about that. And so what did we do to actually stop tuberculosis from spreading? And, there was a vaccine against tuberculosis. There were medications against tuberculosis. But you can see that the fatality rate from tuberculosis actually declined a lot well before we ended up with that vaccine or with that medication. And what actually ended tuberculosis was actually we re-engineered our society to protect ourselves from that risk of tuberculosis. So we got better quality housing. We got building codes put in place. And so our housing was better. It wasn't as crowded. That reduced the risk of people getting infected from tuberculosis. And it also gave people the better quality of life so that they were actually able to recover from tuberculosis more effectively. Likewise, we improved people's working conditions. So people were healthier when they were at work. And if they were healthier, that meant that they were able to recover better. And of course, they were in a workplace which had less risk of them getting infected with tuberculosis. A little bit debated still, but there is evidence that air pollution and pollutants in the air actually make tuberculosis more lethal. And so by reducing air pollution, we've actually been able to reduce the risk of dying from that. We changed some of our hygiene norms, and actually around 1900, it was a social norm for people out in public to spit all the time. And of course, we don't do that anymore. And that was actually a norm that was changed specifically in response to realizing that actually that spit carries a tuberculosis bacteria and that can infect other people. And then we did things like contact tracing in public health to identify infections, isolate people, and stop the spread. But basically, it wasn't necessarily vaccines, medications that brought this to an end. It was actually re-engineering our society to make it a safer society, and that actually reduced tuberculosis. Switching here then to looking at diarrheal illness, kind of a similar story happened there, where the big thing that reduced diarrheal illness is that we improved sanitation and water treatment specifically. And by doing that, we got rid of a lot of those pathogens causing diarrheal illness. And that, has actually been recognized as one of the greatest medical advances in the last 150 years. On top of that, we started to treat water, so there weren't infections in our water. We improved our living conditions, including building codes, and actually got proper bathrooms and the like. And so that reduced the ability of people spreading diarrheal illness into homes. We improved, again, the working conditions, so people were less likely to come across contaminated water. People were working in a more sanitary environment where those infections couldn't affect them. We improved nutrition and standard of living, which improved people's immunity and ability to fight off those infections. We regulated our food production so that our food sources would be safe and not be carrying pathogens that could infect us. We improved irrigation, so water being used to produce our food would no longer be water that might be carrying pathogens that could actually enter our food and then be hiding there for when we consumed it. We in public health are out inspecting restaurants and bars and grocery stores, making sure that the food that's actually delivered to us is safe. And really, all of these together, creating a social norm of hand washing again, all of that, by changing our society and the way we lived, we drastically reduced the risk of diarrheal illness. And I think what we need to be thinking about as we approach COVID-19 is not that we're just going to go back to living life as it was in 2019 and accepting lots of people hospitalized and people getting long COVID and sadly people dying from COVID-19, and we just accept that and we fork over the tax dollars to pay for a much bigger healthcare system to manage that. I think we should be thinking about how do we take everything we've learned about COVID-19 in the last 2 years and do some things that re-engineers our society to reduce that risk completely. And in the process, perhaps reduce the risk of other infections. One of the big things that we've learned is that ventilation stops the spread of COVID-19, and we can really reduce our risk of infection if we improve ventilation. And so we should be updating our building codes to really improve our ventilation, improve our filtration, so we can make all of our indoor spaces safer from COVID-19, and that will actually reduce our risk of getting this infection. Tied to that is, I think we can be doing things like monitoring for carbon dioxide, especially in public places, so we know when a public place is unsafe and we can take action. This is in Japan, and this is actually a movie theater where you can see they have 10 different screens where movies are playing, and they publicly report what is the CO2 reading that they're seeing inside those movie theaters, so people who are going there and going to that movie can have confidence that they're going into a place where the risk of infection spreading has been lowered. This is kind of like us in public health, making public our health inspection data on restaurants. We could start making this kind of data public so people would know how safe the places that they're going to be are going. One thing I think we all know is that because of ventilation, outdoor activities are safer than indoor activities for COVID-19. And one of the things we've done is we've actually seen a lot more patios being created in our regions, and even roads being closed down in the summer to expand patios and allow much more outdoor dining. I don't see why we should stop that. I think this has been a really good innovation, and maybe we can re-engineer our society so that we do a lot more things in the outdoors. We move restaurants to the outdoors as much as possible, at least in the summer months when it's possible, and reduce that risk of COVID-19. I think this is probably going to be some longer term role for masks. We'll maybe not be wearing masks all the time, but maybe every winter when the flu and COVID season comes around, we maybe bring the masks back so that we can have protection. Or maybe we find some defined indoor areas which are higher risk, and then we're going to wear masks when we're in those areas. I think we should be thinking about exactly where we would want to do that. Last 2 years, we have basically exited December with a big wave of COVID-19. And part of that is that we have holiday gatherings in the Christmas time. That leads to infection spreading, and that leads to a surge of infections. And this is actually nothing new. We see that with influenza as well. And so we could always continue with that just being the case, and we always just accept that we're going to have a big surge of infections coming out of the Christmas holidays. Or is there an opportunity for us to maybe rethink the calendar of what we do with our activities? Can we change our calendar so that we have a longer period of vacation time afterwards, so people aren't going back into schools, they're not going back into workplaces and spreading infections amongst others? We need to think about that more. There's maybe opportunity for people to be doing more socializing then, and maybe more infections going to spread that way. But is there opportunity for us to rethink our holiday calendars in the wintertime, so that we can maybe reduce the spread of these infections? Or maybe we shift our schooling so that we're in school less in December and January, and we put a bit more schooling into the summertime when it's safer. And maybe we shift people from taking summer holidays to maybe doing a bit more on the winter holidays. I think there's perhaps opportunities for us to rethink our calendar to make us safer from COVID-19 in the long term. One thing we've noticed, I think, with COVID-19 is also that certain populations are disproportionately affected. So this is looking at quintile of neighborhood diversity. So yellow is the most diverse neighborhoods, so neighborhoods with the largest minority populations. This dark blue is the first quintile, the least diversity, fewest diverse populations. And you can clearly see that as we've experienced COVID-19, neighborhoods with more minorities have had more infections. And that's really translated, I think, into minority populations at being greater risk of COVID-19. And so can we re-engineer our societies long-term to be more inclusive so we don't see this differentiation where places with more minorities see more infection and places with fewer minorities see less infection? Can we make a more inclusive and equitable society? Likewise, if we look at even economic means material deprivation, people who are most material deprived in yellow, so poorest, versus the people who are least material deprived, the people who are the richest, we saw a difference in their COVID-19 risk. The standard of living and the level of wealth, the differences, and in the process actually narrow infections, and we reduce a lot of that high risk infections in our society. I think there's opportunity here for us to do things that actually maybe change our society so that we can reduce the risk of who is actually getting COVID-19. Another area we can think about is staying home. We've all gotten used to working from home much more now, and we've actually had the infrastructure to do it. We should never go back to the point where people who have a cold are showing up in work and perhaps spreading infection. And part of that is we probably need to have some sick pay policies so that people who aren't supported to stay home and who aren't able to work from home, we give them the ability to actually stay home and not spread infection. And by that, we actually reduce the spread of COVID-19 overall in our society. And then, of course, we're going to get new vaccines and better vaccines. The vaccines we have were the vaccines developed in less than a year. Over time, I think these vaccines will improve and they'll perhaps give us better immunity and immunity that might not wane. We're, of course, now seeing some new medications coming online to protect us from COVID-19. And if we do get severely ill, and that will hopefully prevent people from being hospitalized, and that's going to help as well. And I think if we can address the vaccine rollout globally and get more of these countries and parts of the world where people do not have much vaccination, that'll reduce the risk of people bringing COVID-19 into our society. It'll reduce the risk of new variants emerging and make our society safer overall. And so these are all a whole bunch of things that I think we need to start to think about what does our post-COVID pandemic society look like? If we want to go back to 2019, I think we're going to accept a lot of people getting sick still, a lot of hospitalizations, people getting long COVID, and sadly, people dying. And of course, a lot of tax dollars that we're going to be spending to ramp up our healthcare system, basically indefinitely to deal with that increased burden from COVID-19 forever as it stays endemic. Or we can do some of the things here where we invest in our society and improve it and actually reduce the risk of COVID-19, but probably actually reduce the risk of influenza and a whole bunch of other similar infections in the process. And we end up with a society that is safer overall and probably better overall. And we don't actually have to deal with, ramping up our healthcare sector to deal with the risk of COVID-19 long term. And I think as we discuss and have the conversation about moving to endemic, we really need to start to talk about some of these ideas and what the society we want to have looks like going forward. So I've talked a lot, so I'll stop there and turn it back to over for questions.
Great, thank you. Okay, so to start, we have Paul, and you should be able to unmute now.
Can you hear me okay?
Yep.
Thanks, Courtney. So Dr. Hirji, I think you mentioned we're only at about 20% capacity. I think you said is that for boosters or is that shots overall? But either way, do you have any magic solutions on how we can get that up? I mean, that's astounding that we have that kind of capacity just being wasted. When there's such need to get shots in arms.
Yeah, so that's all shots. It doesn't matter to us if you're coming for a first, a second, or a booster dose. It's the same work for us. So any combination of those is what we could deliver. And yes, it is about 20% capacity across all Niagara partners of vaccines we're delivering. So some of the work we've doing is with the COVID-19 task force, we've developed an enhanced communication strategy where we're doing a lot more paid advertising and promotion of vaccines to hopefully encourage more people to come. You've noticed we've started doing some additional clinics. So we're today in Port Colborne doing vaccination clinics. We were at a few schools last week. Later this week, we're in Wainfleet. We're starting to get back out in the community to do more vaccinations to hopefully deliver vaccines in places where people are to hopefully improve access. And we're going to be going back to some of the work we were doing a few months ago, where we are looking very carefully at some of our market segmentation data to try to really understand the groups who are not coming to be vaccinated, not coming for their booster doses, and how we can better target messaging to them. But I think we really need all of society really encouraging and setting a social norm that we want to get booster doses in if we're going to get that number up. And I think, something we should also be thinking about is things like the proof of vaccination requirement. I've shown you that 2 doses of vaccine doesn't necessarily prevent us very well from infection, whereas 3 doses does. And I think we probably should be updating that proof of vaccination requirement to incorporate people getting booster doses to make sure that we keep those public places safe. And that proof of vaccination will actually be keeping people protected.
And a follow-up?
Yes, and the 5 to 11-year-old age group, the numbers are still lagging. Is that still key to keeping infections under control overall, getting those numbers up?
Yeah, I think getting numbers up in any group is going to help with reducing infections overall. But with that 5 to 11 age group, they're in kindergarten, they're in schools, they're around lots of other people, and it's really a prime opportunity for infection to spread. And of course, children, they're going to be playing together. They're maybe not going to be the most diligent about wearing their masks. They're, of course, kids. And so I think it's even more important that they have that dose of vaccine as their protection, because some of those other protections that maybe work for us aren't going to necessarily work as well for children. And I think they would really benefit to have that vaccine to make sure the schools are safe for them.
Okay, thank you. Up next, we have Gord, and you should be able to unmute.
Hi, thanks. Especially in the past weekend, we've heard a lot of talk of people talking about being naturally immune because they've had the infection. How much is natural immunity that way worth versus vaccination as far as the immunity it provides?
Yeah, so if you've just had natural immunity from getting the infection, first off, if you got infected with something before the Omicron variant, it's like the vaccine. It does not necessarily give you, with 2 doses of vaccine or infection with something pre-Omicron, a lot of protection against the Omicron variant. The Omicron variant has evolved so much that it just evades the immunity that we may have had before. 3 doses of vaccine definitely gives you a lot better protection against Omicron than a pre-Omicron infection. If you've been infected with the Omicron variant, it does give you some reasonable protection, but some of the early data is seeming to show that people are losing that protection actually relatively quickly. And what actually gives the best combination of protection is either 3 doses of vaccine, so 2 doses plus your booster dose, or 2 doses of vaccine plus an Omicron infection that's mild thanks to those 2 doses. And those 3 elements then gives you actually pretty good protection. So people who are fully vaccinated and then got infected recently with the Omicron variant, they probably actually do have pretty good protection. Well, we may see that in protection lag over time. So I would encourage them to come and get their booster dose eventually. If they have a pre-Omicron infection, though, I would not say that they have a lot of immunity, and they absolutely do need to get their vaccine to be well protected.
And a follow-up?
We've heard a lot too about the new BA2 variant. Has that turned up locally at all yet? And how much of a threat do you think that is to sort of disrupting our plan to keep opening?
Yeah. So haven't seen it show up locally. And the broader question of what kind of threat is it is, I think, a bit of an open question. There are some countries like India, like Denmark, where that basically, subvariant, I guess, of Omicron seems to be spreading more quickly than the BA1, which is a version of Omicron that we currently have, and is basically taking over. And that would imply that it has some advantage in spreading. And so therefore it is taking over. And that's really what we saw, for example, with the Omicron variant taking over the Delta variants. And so there's some concern in those countries that, is this a new variant that is actually going to take over? The flip side of that is that in Canada, we're actually one of the first countries that identified the BA2. We identified it back in November. And it's popped up from time to time and just basically fizzled every time it's popped up here. And it doesn't seem to be effectively competing against the BA1 here. And so not really sure why some countries are seeing BA2 take over. In other countries like us, just generally aren't. And so I'm not really sure how much we can say it is worrying. The one other thing that's interesting with the BA2 versus the BA1 is that it looks like the vaccine is a little bit more effective against BA2 than it is against the BA1 we're facing right now. And so perhaps, if it did become dominant, we might actually benefit in some ways from the vaccine a little bit. But I think it's right now too early to say, because we're not really understanding what the threat it poses is. Is it really actually spreading more? Is it going to be something that starts to take over here or not? I just don't think we know enough yet.
Thanks.
Okay, up next we have Richard, and you should be able to unmute now.
Hey, everybody. Just wondering if public health has made any progress in its investigation of that maskless pod school in Virgil. I know we talked about this a little bit this week. Doctor, you talked to Evan about it, but just wondering if there's any updates on that situation and if you have any further comments on it.
Yeah, I don't have any update for you at this point. We're working with the regional Niagara Region's municipal licensing and enforcement office to really investigate that situation. Don't have any further update at this point.
Okay.
And a follow-up?
Yeah. So, I mean, with the BA2, you mentioned there's not a lot we know about it. Is part of that because we just don't have the testing going on to know if it's becoming big in our community, and with that is there any plan down the line to start doing more testing again?
Yeah, in terms of any plan to do more testing, that's really about the province who's setting the testing criteria. I certainly would like to start to test more people, but it's going to be up to the province if they decide that that's the road they want to go down. In terms of the limited testing, is that hampering our ability to detect the BA2? To some extent, it probably is a little bit because we're not testing every single person out there who's getting infected. So it's possible that maybe we've missed where the BA2 is spreading. That being said, everybody who is still getting tested, healthcare workers, people in long-term care, people who are severely ill and hospitalized, all of those people are still getting tested. And in that, we're basically detecting almost entirely BA1 and very little BA2. And if there was BA2 spreading out in the community, you'd think it would infiltrate some of these populations and not just somehow be in some population that we're not testing only and not getting into the rest. And so I think it's pretty unlikely we're missing, the BA2 spreading. I think we just don't understand it well enough to understand who is going to get sick and when is BA2 going to spread widely versus not.
Awesome. Thank you.
Thank you. Okay, up next we have Dawn, and you should be able to unmute.
Yeah, thank you very much, Dr. Hirji, for taking my question. I'd like to expand a bit more on Niagara region and the wastewater testing that's being done there. Can you kind of give me an overview on how this all came together, how long you've been doing it for, and kind of just give me how it's working out?
Yeah, so this is really a partnership between us, Public Works in Niagara region, who of course runs the wastewater treatment plants, the University of Guelph, and the Ministry of Health, all working together to do this work. The initial work on it actually started in the fall of 2020, when we first realized that wastewater was actually able to pick up signals of COVID-19. That I think really came out in the summer. And so in the fall, some pilot work began, and we are in one of the areas that volunteered to be part of that pilot project. Through that pilot project, it showing that it was successful and there was some correlation of the virus fragments we detected in wastewater and what we are seeing in terms of the surges of infections in society at large. And so really since about May or so of 2021, we've had regular wastewater testing across all 6 of Niagara region's wastewater treatment plants. Samples are collected at the wastewater treatment plant. They're sent to the University of Guelph, which actually does the testing and then does a little bit of the analysis. And through a central data system set up by the Ministry of Health, we actually then get access to that data so we can see what it's doing. And then provincially, that data is being collected from us and many other parts of the province and all aggregated together so the province can have a global view of what's going on with wastewater surveillance. So hopefully that answers your question.
Yeah, it does. So can you anecdotally say how you feel about it right now? I mean, I work out of Hamilton, as you know, and so that question's come up to our medical officer of health several times, and she's really kind of downplayed it as being effective at all, not giving good results. Where do you stand on that?
Yeah, I'm not too different from what Dr. Richardson thinks. 2 weeks ago, if we actually look at the media briefing, then if I can remember if you're a part of it, I went in a little bit more detail where the patterns don't necessarily always seem to make sense. I focused really on the Grimsby wastewater treatment plant, where it seemed to imply that there wasn't really any COVID-19 going around in December, when we were, of course, detecting lots and lots of infections. And then, even the graphs I showed you today, it doesn't really show a consistent pattern. There's a lot of ups and downs, and it's hard to really interpret too much from that. My suspicion is that the wastewater testing is maybe a more reliable indicator of COVID-19 maybe in a place like a Toronto, where you have a dense urban area, you're going to have a lot more people. And, whenever you have a larger sample size, you start to get more reliable measures. Whereas in somewhere like Niagara, where we have a relatively smaller population split across 6 wastewater treatment plants, we are ending up with much more unreliable data, and it's harder for us to really interpret what a pattern is there. So, it's a piece of data that we're looking at because we don't have good quality testing of everybody in the community to know what the trends are with COVID-19. But I really feel that it's only one piece of data, and we have to look at it in context with everything else to really get a sense of what's going on. And I don't think on its own, it really gives us a very strong signal on its own.
Thank you.
Thank you. And up next, we have Penny, and you should be able to unmute.
Okay, thank you. Dr. Hirji, you said there was good news with you feel that we've reached a peak and we're kind of on the downward side now, but you also seem to sound like you feel that maybe this opening is just coming a little too soon. Is that correct? Can you explain how you feel about the openings that are happening this week?
Yeah, I think that's a fair comment of what I feel. So, I'm thinking back to the second wave last year, where, of course, we had a surge of infections, we peaked, they were starting to come down, but they hadn't come all the way back down. And the province went and reopened in mid-February. And what we basically saw is over the course of 6 weeks, those infections basically resurged and started to go right back up because we hadn't put in place the conditions where we could make sure that those infections would stay low. And I worry that's the kind of scenario we're seeing playing out here. Yes, we've peaked in terms of our hospitalizations. They've come down a little bit, but they're still at a very high level. They haven't come down all the way. And if we take actions that allows more infection to start spreading out in the community, that's going to mean more people get sick, more people start to be hospitalized, and we could see everything just actually reverse and go right back to where it was previously. And I think we're, of course, dealing with our hospitals in a pretty precarious situation already. They're dealing with very high numbers of hospitalizations, still higher than any previous wave in terms of where they are right now. And here in Niagara, of course, our Fort Erie Urgent Care Center is still closed because all of those healthcare workers need to be moved over to the hospital to deal with the surge of COVID-19. And so we're not in a place where hospitals have recovered where they could handle a resurgence of infections. The one difference I'd say between this year and last year is that this year we had a lot of vaccine and we got a lot of booster doses out over the course of January, whereas last year we didn't really have much vaccine, and so not a lot of vaccine was going to be helping us. But I think if we're basically then relying on that vaccine being enough to prevent a resurgence of COVID-19, maybe it'll turn out that way. I don't think we know, and I'd really have liked to see as a province at least have some modeling showing that this reopening would be manageable. Instead, we're, I think, reopening without the benefit of that modeling. We're going blind and taking a leap of faith. And that concerns me because I think we've seen in the past that things don't necessarily go the way we want them to go. This virus is unpredictable and tends not to behave the way we hope it will. And I really do worry that we could see a resurgence as a result.
And a follow-up?
Thank you. That was clear. The other issue that we haven't talked a lot about is kids in school. I know they've only been back for a week and it's probably pretty hard to have much information, but do you have anything at all that gives you a sense of whether our schools are as safe as you were hoping, or any feedback at all from school boards?
Yeah, it's early days, as mentioned, so I don't think we can say too much yet. I'm certainly pleased that we aren't seeing any schools that have really massive amounts of absenteeism, where the school needs to be closed down because infections are running out of control, or where there's so many staff getting sick because infections spreading in the school that the schools actually had to themselves close down administratively. When I look at the provincial data, there's definitely some schools across the province that have had to actually close down over these last couple of weeks, which is something that we've thankfully not seen yet in Niagara. But really concluding too much, I think, is going to be difficult at this point. I think we're not seeing the worst possible outcomes right now, which is great. But I think hopefully with more time, we'll get a better sense. And hopefully that sense will be that schools remain reasonably safe for children. Key thing, of course, is, I keep harping on, is that the more children are vaccinated, the safer they're going to be in school. And I think that's really the most important thing we can do to keep schools safe and keep children safe in school.
Thank you.
Thank you. Seeing that we've reached our time for today, we won't have time for round of second questions. But as always, if you do have kind of follow-up questions that you'd like to ask, feel free to email myself and Lisa and Alex, and we can work on getting an answer, a response for you. So yes, we'll end it there, and thank you everyone for attending.